To be honest, before volunteering, I wasn't very empathizing, I wasn't very sympathizing with people. Ever since my grandpa passed away, I regret not taking care of him very well. And there's a lot of things that I didn't do with him. And I didn't want any other elderlies to feel the same way. And I feel like this is something my grandpa would want me to do, is to bring back to the society, to make sure that all elderlies, they don't feel lonely. You know, if you just treat them as elderlies, it's going to be very difficult for you to communicate with them. There's a huge gap there, it's an obvious gap. But if you treat them as friends, as like your grandparents or your family members, I learned to try to understand their problems, their issues. Certain cases where some elderlies, they have dementia, they tend to repeat things. I think what I learned is that you can't just be, oh, I thought you mentioned this just now, oh, I thought you mentioned that. You have to go with the flow, you need to understand them.
Over more than 10 years, and I've seen how the members actually benefited from the empathy support group. They were even thinking of how they can actually pay it forward and not just be on the receiving end. So it also shows that they were also inspired by the work that the group has done.
From a small group, it has become a community. There are sessions run by the members themselves, from like sports like rock climbing to information sharing about finding employment or writing resumes.
Nothing is impossible because they get to try sports that they have never tried before when they were able-bodied, and then now with amputation they actually are doing a sports that, you know, they didn't imagine themselves doing.
Sam, I've known you ever since you were newly diagnosed with type 1 diabetes. When you were 14 years old, I want to affirm you for your dedication and commitment all these years, because you were my youngest volunteer in Sugar Rush, 14 years old, and you are the longest serving and still serving.
Growing up, I always had the mentality that no, I must take matters into my own hands. Like, I never liked the idea of things being imposed on me or I don't have a say in something. I think the repercussions is really scary, especially like for someone who is diagnosed at a very young age, because you would know that you are living with diabetes for the rest of your life. That whole negativity and also stigma around it was something that really kind of motivated me to want to be part of Sugar Rush, because I want to let more people know that actually living with diabetes is not like that. It's not like what you see on TV.
Before our group was set up, I actually attended a support group by NKF. That was before COVID. When COVID came, all this group had to stop because we cannot meet anymore. During the COVID time, there were many people who had to start dialysis. Peritoneal dialysis is a very lonely journey for patients, and support is very important for these patients. Then during the COVID time, there was a particular patient. She stays alone and she has got no caregiver. So we created a group chat with her, and during the night when she is doing her therapy, she sort of video called us and were able to like help her get familiarized with how she connects the machine and all that.
The initial stage, when doctor tell you you have cancer, you may have a little bit shock, but after the shock, after the phobia, you better be calm. And then you say, I am going to fight this cancer war. I have gone through that stage of cancer. I know the thing inside out. And I do not want people out there who see the word cancer straight away say end of the world. So I would rather try to help them. In most of the cases, it's after doctor talk to them, surgery done, the hospital will call me to help them, guide them along. So normally I will work with them for at least about 6 months maximum. 6 months, bring them for checkup, bring them for diagnostic, teach them what are the things to do, what are the things not to do. It let people forget about what you have in cancer, everything throw behind. You just move forward, you are a normal person, right? Don't feel bad.